Good evening, everyone. That's Walid Tawfiq, and that presentation is for clinical practice and problem solving for adult pathology section in FRCS trauma and orth exam. So, to get the maximum benefit of this video, follow the following instructions. At least two candidates should be practicing to give the feedback to each other. See the image or listen to the scenario. Pause the video after each question. Answer the question loudly. Try to start broad. Don't dedicate yourself to a diagnosis. Use the algorithm used in the previous videos. The next question will provide you with more information to direct you to the diagnosis and the treatment for this specific case. The feedback should be written to simulate the exam feedback as possible. Let's go. Case 1. 71 years old woman left total knee replacement 8 years ago in another hospital. We don't have an access to the operative notes. Past medical history, rheumatoid arthritis, obstructive sleep apnea. She's a smoker. Describe what you see. What is your differential diagnosis? What are the important points in history you want to obtain? How to examine the patient? What are the further investigations you require? Suppose infection had been excluded and the patient needs operative treatment. Describe the basic principles. Remember, this is a clinic setting. That's the treatment received. Case 2. 43 years old woman presented with painful right hip. Describe what you see. What are the important points in history you need to know? How to examine this patient? What are further investigations you will need for decision making? What are the treatment options? Suppose the patient chooses to go for operative treatment. What are the expected challenges? Case 3. 45 years old woman have a left knee pain, failed on operative treatment. Describe what you see. What are the important points in history you need to know? If you think about UKR/high tibial osteotomy, what are the important points in examination you need to focus on? What are the other imaging studies you require for decision making? How to counsel this patient about operative intervention options, high tibial osteotomy /UKR/TKR. That's the treatment received. Case 4. 73 years old, left total hip replacement many years ago. Now struggling to bear weight and using 2 crutches. Post-medical history, hypertension, CABG 2015. Describe what you see. What is the important points in history you need to know? How to examine this patient? What are further investigations you will need? If you aspirate the hip, what lab test you will ask for? Suppose the patient chooses to go for operative treatment, infection excluded. What are the expected challenges? That's the treatment received. Case 5. 47 years old man, IT consultant, twisting injury since 1995, continuous day and night pain. Describe what you see. What are the important points in history you need to know? How to examine this patient? What are further investigations you will need? What are you looking for? What are the treatment options? Suppose the patient choose to go for operative treatment. How to counsel this patient regarding fusion versus replacement? Treatment received: arthroscopic assisted ankle fusion. Case 6. 77 years old woman struggle bilateral knee pain. Concerned that the shape of her left knee getting worse since last year. Describe what you see. What are the important points in history you need to know? How to examine this patient? What are further investigation you will need? What are the treatment options? How to counsel the patient? Suppose the patient choose to go for operative treatment. What is the time frame for scheduling for surgery? What are the expected challenges? That is the treatment received. Thank you.